Well, today on the show, we're at Singing River Health System in their med spa on the third floor of, I guess it's the
Singing River Medical Park.
here. We've been here several times before. Dr. Ryan Logan, how are you, sir?
I'm great. How are you?
We're here to talk to you about being in the med spa, something that a lot of men and women do every day, and that's get Botox.
Right.
Botox, fillers. These are basically non-invasive types of things that you can have done to
Slow
get rid of
down and
wrinkles.
reverse some of the effects of aging on the face. We use it preventative as well.
Now, what exactly is Botox?
So Botox is a neuromuscular blocking agent derived from botulism, which in the severest forms will cause complete paralysis. But we use such a tiny amount in Botox that we can dilute that, we can inject it, and we can shut down some of the smaller muscles in the face and other areas of the body to just relax the wrinkle that happens over time. Gets a pretty nice effect.
So it just basically, like you said, it relaxes the muscle.
That's right.
Because that's what's tensed up in there causing the wrinkles.
Right, so these orbicularis muscles are on the side of the eyes. They contract as we squint in the sun, and then we form these crow's feet out here to the side. And when we relax that muscle, the skin goes back to its more relaxed state, and the wrinkles will fall out. Also, the forehead, we can develop wrinkles in between the eyes, and we block the frontalis muscle, and the skin relaxes, and the muscles and the wrinkles kind of fade into the distance.
And it takes, I guess, a few days for it to take effect?
It does. Some people think they're going to get an immediate result, but it does take a few days. Some people will have effect in 2, 3, 4 days. Some take about a week or so, but it's a slow, gradual process. Which would you want? You don't want to go to work one day with wrinkles and then show up the next day and everybody knows you're Botox. We want a subtle change.
Yeah, that's kind of a surprise.
Yeah.
How long does it last?
So about 6 months, give or take. And some of the things that I've noticed with people that their Botox doesn't last as long is if they have a lot of heat exposure. Botox breaks down with heat, which will keep
So if you're out in the sun a lot?
out in the sun a lot, you're using a blow dryer to blow the front of your hair will destroy some of the botulism toxin, and it'll go away faster. But it's person to person dependent.
So how do you know if you're a good candidate for it? I mean, you got to be sure that, like women, if
So-
they're blow drying their hair, you want to stay away from that.
If they have Botox in, it doesn't cause wrinkles. It's just
Right.
But if you have wrinkles, and a lot of people will already kind of have an idea through research or talking to friends. Hey, would like some Botox. That's when you come into somebody like me or one of our other practitioners that work here at the hospital or other spas, and see what they have available. Some people, Botox is not going to make a big difference, and that's where we would want to move into more of the fillers, like Radius or Voluma or
Juvederm or something like that. So, okay, well, you mentioned that. Talk about fillers. What exactly, I mean, here we got the Botox, it relaxes the muscles and everything. What do the fillers do?
So the Juvederm we use in lips and other areas, it's all derived from a hyaluronic acid base, and the other ones are, as we've gotten more advanced with them, are thicker and are designed to work in different parts of the face. So for instance, in our early 30s, we start losing a lot of volume in the face. So we start to see this drooping. Well, it's subtle, but where it really shows up, these lines along the side of the mouth.
Right, yeah.
So a lot of times I'll have a patient come in that wants to have those lines filled, and they say, I want Juvederm right here. Well, that's where a little expertise comes in. Really, we need to refill the volume around the cheekbones.
Really? I always thought you attacked the point of where it, but that's not necessarily true.
We attack the cause. We lose 5 or so cc's or mLs of fat, and we start to see that drooping, and we can replace that with a similar product. Wow. And actually, in some cases, one of the products actually will build back some collagen to hold that up in the future.
Now, can you do, let's say you do Juvederm, can you do that and Botox at the same time?
Absolutely. So, and that's the best way to get a good result is let's shut down the areas we can relax with just muscle relaxation with the Botox product, and then we go and find the areas that need the volume restored, and then if we want a little more cosmetic effect, sometimes we can do a little bit in the nose to cover a hump, or we can put some in the lips for women who want fuller lips. One of the things that's neat though, and I just actually came back from LA, I had the opportunity to go out there and train with a doctor that does this all day, every day, and really taught me some neat stuff. But men are typically, they're coming around to the idea of Botox, but the injectors, the fillers are getting a little feedback, a little hesitancy from them.
Right.
But actually, in men, this loss of volume, when we refill it, actually has a masculine effect. Like a football player, or they put these dark lines under their eyes. That line, that chiseled look, is a masculine effect, and really has a cool effect in men. So it's something that we should, that I'll certainly do when the time comes. Luckily, I haven't lost a lot yet.
Yeah, well, no, you're pretty young though. So I mean, when you get my age, that stuff starts to droop, fall, hit the crevices and all that stuff. And you have to start looking at those kind of things.
Right, and some of the things that we do are preventative. So before we get crow's feet, let's maybe shut the muscles down, relax them a little bit to prevent that from happening. But living on the Gulf Coast, we take such poor skincare. We tend to spend a lot of time in the sun. I mean, we go to the island and just hours in the sun. Well, sunscreen, moisturizing protection is something we should start doing in our teens or younger. That prevents some of the aging effects of the skin early on.
And you can get, I mean, being out in the sun, you can still get, everybody likes to have a good tan, but you can still get a good tan, but still make sure that you do use, a good strong SPF.
Right.
At least 30.
Well, at least
when you're
30.
out there.
And today I drove to work. I'm going to spend most of my day over at the hospital seeing patients. I'm going to drive home. I'm going to spend very little time in the sun. I'm wearing SPF 20 right now.
Really?
Because just to drive to work, the sun exposure to your hands.
Of course, with me, I have to wear SPF 50.
Right, you have to wear a whole hat.
I definitely do that. I got about a minute left. How do you avoid getting the overdone look to where you really look plastic?
That's where you go to somebody that has the same goal for outcome as you do. Some of the worst effects we get is when this overdone, this stone face, lips twice as big as they should be. So it's all subtle. Nobody should ever say, "Oh, I can tell you had work done." You want hey, you look rested. What kind of facial product are you using? Not where did you get your Botox done?
Yeah. So, and I guess this is pretty much is a substitute for surgery?
It is not a substitute. We can do some things that surgery could do otherwise, but it's certainly not a replacement. It's more cost effective, and one of the things that we're doing here is we're offering a 20% discount. So we're, Juvederm, Botox, $12 a unit, and we're down to, we do a 20% discount, so we're out.
Yep, every Thursday.
Every Thursday.
Every Thursday they're doing that during the month of November. So remember that 20% off of the Botox every Thursday during the month of November. So call and make yourself an appointment. Thank you so much. Appreciate
Absolutely.
it, Dr. Logan. If you want some more information, the phone number is on your screen. It's the Med Spa here at Singing River Health System
At Singing River Medical Park.
in Pascagoula. It's located just east of Singing River Hospital. Botox, Juvederm, fillers. It might be something you need. I'm definitely going to look into it.